listener production.
Hi, Natarsha Belling with you and welcome to the afternoon edition of The Briefing. Coming up in our deep dive, the increase in dangerous misinformation on TikTok about contraception. How influencers without any medical qualifications are telling women what to do during sex that's leading to unwanted pregnancies and a concerning increase in STIs. But first, let's check the afternoon headlines this Thursday, the 14th of August. Anthony Albanese claims a statement from Hamas applauding Australia for committing to recognise a Palestinian state is incorrect and propaganda from the terror group. 9 newspapers yesterday reported the comments came from a senior Hamas official, Hassan Youssef. The Prime Minister hit back today, saying Youssef is currently in jail and has no means of communication.
Hamas will engage in propaganda because what is happening is the international community are united about isolating Hamas, about supporting a peaceful way forward. So I won't be a cheer squad for Hamas and for its statement.
There are reports a statement has also been issued by Hamas on its Telegram channel, denying the issuing of any earlier statement from Youssef. US President Donald Trump has warned Russia will face, quote, very severe consequences if it does not agree to stop its war with Ukraine. The statement comes just hours after a phone hookup with key European leaders, including Ukrainian President Volodymyr Zelensky, about the ongoing crisis. President Trump saying the meeting went well.
No, we had a very good call. He was on the call. President Zelensky was on the call. I would rate it a 10, very friendly. If the first one goes okay, we'll have a quick second one. I would like to do it almost immediately. And we'll have a quick second meeting between President Putin and President Zelensky and myself if they'd like to have me there.
The US leader will meet Russian leader Vladimir Putin face-to-face later this week in Alaska. And the sole survivor of a helicopter crash in the Northern Territory has admitted to trafficking cocaine. The crash is at the centre of a criminal trial of Outback wrangler Matt Wright, who was accused of perverting the course of justice. Sebastian Robinson was the pilot of the chopper when it crashed, leaving him a paraplegic. Mr. Robinson has admitted to trafficking cocaine to friends prior to the accident. He has also told jurors Mr. Wright visited him in hospital after the crash and deleted notes and texts from his phone. Matt Wright has pled not guilty to 3 charges of perverting the course of justice. Now it's time to get into our deep dive on the increase on medical misinformation on TikTok. New Australian research has found only 10% of posts made about female contraception were by qualified medical professionals, with dangerous sexual health advice flooding social media, which can often be false or deceptive, leading to an increasing number of unwanted pregnancies and also an increase in STIs. We chat with co-author of the research and public health expert Megan Bugden on what they uncovered. Megan, thanks so much for joining us. You were involved in this research by La Trobe University. Some of the findings are actually extraordinary. You analysed 100 TikTok videos on contraceptive health that have amassed nearly 5 billion views and 14.6 million likes. Only 10% of these videos were actually created by qualified health professionals. How concerning is that?
Yeah, look, quite concerning from our perspective, because even those that were created by health professionals didn't score very well when it came to reliability and quality. So they weren't doing things like referring out to additional resources or talking about the pros and cons of the different contraceptive options that were being discussed.
So in regards to what advice some of these people were giving, and it's really important to mention they're not qualified health professionals, this is around contraception, especially for women. Is that correct?
Yes, that's correct.
They were actually saying or advising people with no qualifications or medical professional knowledge not to use it. Why?
Yeah, so the why isn't something that we necessarily explored, but one of the things that we found particularly distressing was the distrust of and explicit rejection of hormonal contraception methods, often in favour of promoting hormone-free natural birth control methods, also known as fertility awareness-based methods. And alone, this method isn't inherently bad. But what was bad was how the videos failed to disclose potential limitations of this method, which include things like motivation, partner cooperation, biological variabilities as well. And importantly, they were failing to say that often you do need a barrier method like a condom when you are using this method. So in many ways, these videos in particular can mislead young people and have the risk of increasing both unplanned pregnancies and STIs, which we know are increasing within Australia.
I'm glad you make that point there in the fact that it's not just an increasing number of unwanted pregnancies, but also a concerning increase in STIs, which is affecting so many young people at the moment and also people of all ages.
And from our perspective, when individuals on these platforms don't have access to accurate, unbiased contraceptive health information, they're not able to be making informed, empowered decisions. And one of the other things we noticed was that because individuals weren't saying, this is just my personal experience, talk to your medical practitioner about this, then individuals aren't being encouraged to take this information, to take what they've seen or what they've heard to their general practitioner and have a conversation about the information they've seen, how reliable and effective it might be, because, we have different recommendations in Australia to what we have in the UK and in the US, and finding a method that's going to suit them best.
So Megan, in regards to people consuming social media and also TikTok, you mentioned earlier your research shows that a growing number of young people don't trust health professionals or modern medicine. Do you know why that is, and that even though these influencers aren't qualified professionals, that they believe what they're saying more than qualified health professionals?
It wasn't something that we necessarily explored, but we do know that for some individuals, platforms on social media like TikTok can be really validating for individuals to share the negative experiences that they may have had within health systems, which include having symptoms ignored or being dismissed in those one-on-one settings. So individuals can view these messages online and feel validated, feel seen. And this is, a great positive of platforms like TikTok is that we do get that information. But what we would say is we want individuals to make sure that they're taking that information to their GPs as well. And from the medical practitioner side of things, it is important for practitioners to understand that the traditional dynamic within a health setting is evolving now, often because of things like TikTok. An individual is bringing these, whether they're accurate or inaccurate, assumptions about contraception with them when they're going to medical appointments. And so practitioners need to work on rebuilding some of that trust that we found is missing. And that can be done through things like shared decision-making on contraceptive options. So making sure a practitioner actually goes through multiple options with individuals rather than just relying on, a traditional method like a hormonal contraception, which is super effective, but also does have side effects. So make sure you are going through informations with patients, making them feel more empowered.
So Megan, from your perspective, when you looked at this research, in regards to not only the unwanted pregnancies, but also the increase in STIs, where do we need to close that education gap? Because you spoke about the fact that some people may have had bad experiences one-on-one with a GP, or that they're actually seeking out the correct information because they've been let down by, one may argue, an outdated system. Do we need to start putting sex education back into schools? Because obviously those really important health messages aren't getting through.
Yeah, definitely schools is one avenue that this information needs to be taught in. And I think that's about helping individuals be able to develop more media literacy to understand and distinguish what's credible health information and what's not. And schools can be a platform for that, but also public health organisations have an important role to play because, TikTok does have a huge reach, an excellent opportunity to disseminate accurate, reliable, non-judgmental information on these platforms. And part of doing that can be partnering with influencers that already have a trusted voice that young people are listening to. We don't see enough of that happening at the moment. So there's definitely space for more public health work to be occurring in that space.
We've spoken a lot and there's been a lot of coverage about tighter regulations with social media because, as we've seen with all different platforms or the advances of technology, the legislation is often outdated and not catching up with what's happening in 2025. Do you think there needs to be a crackdown on misinformation with influencers I know there was certainly a highlight if you're part of getting paid for a product, you have to clearly highlight that, hashtag it's an ad, or you have to declare those interests. Does there need to be tighter regulations of what these influencers can say and the misinformation they can spread?
From a public health perspective, regulation is always important, but it needs, alongside any regulation, you do need education to be occurring. So that's always one piece of the puzzle, but we also do need to work with influencers and with young people about increasing their understanding of how they can make their content more credible. So like for an influencer sharing their personal experience, all they would really need to add into that was, this is just my personal experience. Make sure you talk to your GP. And that would increase the reliability of the messaging because it's signaling to whoever's viewing that this is just a personal experience and it's not, it's not as persuasive.
And Megan, you mentioned earlier about the role that our governments can play in this to have an important space in dispelling this misinformation. Is there a duty of care that we need to see our health departments right around the country start to use these platforms to get those important, accurate messages about our health across?
I think it's definitely important that we start moving into this space just because of the huge reach that it does have and how effectively, if we get on this platform, we can reach young people that perhaps don't have access to other forms of education in the way that they have access to TikTok. So it's absolutely vital. And, it can be quite easy for us to rebuild trust on this platform through sharing accurate, unbiased, credible information in a mode that young people like to consume. That's how they like to receive their information. So we do need to keep evolving how we are sharing health information. And I think moving into social media is an important part of that process to empower young people in particular.
Megan, what advice would you give for people that are consuming these social media platforms and watching these videos with influencers? What advice could you give them?
I think it's really important to know that contraceptive advice on these platforms can be misleading, can be incomplete and can be biased and often contradict medical guidance. So when you're viewing content, always ask yourself, where's the information coming from? What's informing that individual's opinion? Always look to see whether they have uploaded resources that you can then go and check. So have they cited where they've gotten their information from? Because knowledge is powerful. So use TikTok as a tool in your arsenal, but make sure you take that information to your health practitioner so that you can get a more unbiased and accurate view of the contraceptive information and methods that you're hearing about on this platform.
All right, Megan, we appreciate you joining us today. Thank you so much.
Thank you for having me.
That was public health expert Megan Bugden. And that's it for this episode of the afternoon edition of The Briefing. We'd love you to subscribe or follow us on Instagram at The Briefing Podcast. And we'll be back in your feed tomorrow morning. I'm Natarsha Belling. Thanks for your company.